ready to go.
All right. I am going to call to order the March 27th Jefferson County Health and Human Relations Commission meeting. Today we have first on our agenda to review the minutes. Did everyone review minutes? So I'm going to make a motion to approve the minutes from our last meeting on, I believe, March 2nd.
I'll second that.
Okay, I'll second it. All those in favor say aye.
Aye.
All right. Any opposed? Okay, all right.
It was the third.
It was the third, okay, sorry. That was just my brain and not having my notes.
You can-
I wasn't able to scroll fast enough on my phone. Great, wonderful. Minutes are approved from the March 3rd meeting. So next on our agenda, we have time for public input and any agenda items submitted online. I'm not aware of any agenda items submitted online, and so we do have public input from our request to have Lindsay from the health department come and talk to us about progress that has been made this year through the health department. So would you like to?
I'll share.
Okay.
So I don't really have it, I don't know exactly how you guys wanted it structured, but I kind of just broke it down by different topic areas for the health department. So in 2024, we worked with the Tobacco Coalition that has TPC funding through the Indiana Department of Health. They have a full-time coordinator, Amanda Simeon, and they had that's through a grant through IDOH. And then they also have a grant that has a part-time youth tobacco prevention and cessation coordinator. And she was doing really well in the Southwestern schools. It's Kim Crawford. She has honestly a very impressive group of kids out there that are showing up regularly to do this. And because of that, we decided to start a contract with her to make her full-time to match what the state was giving. So she is able to get, she's been working with Madison schools as well. We have a member of our staff in the past year that did the Catch My Breath training. That's our school health liaison. So that's a youth tobacco program. And then we do in-school vaccine clinics still. And we do one in the spring and one in the fall. So the spring is routine vaccines and the fall is flu or COVID, depending on parental preference. We have started doing school open houses. So we go into the schools either during like registration or open house so we can check statuses for parents for their students and just kind of help alleviate a little bit of pressure for the nurses at the schools. We participated in the Healthy Youth Tailgate that's done at the Madison High School, junior high. And we have met with the JAG coordinator at Southwestern and donated some hygiene supplies. The same with the youth shelter, and then also there was some nurses at different Madison schools that wanted feminine hygiene products. We were able to use some of the healthcare's funding with that. We also provide EpiPens, Narcan, and albuterol to the schools that want it. Those are emergency stock medications is what they're called. So most of the schools accepted all three, and we have a couple of schools that didn't want one or the other, but most of them accepted all three. We are working.
Can I interrupt? I'm sorry.
Yeah.
Did they say why they didn't want them, or did they?
It's a school preference.
Okay. Is it the administration or nursing?
It's administration. Everything came from administration. And we started with asking the nurses, but the nurses, that was part of the question and requirement is that they would talk to administration about it. So administration made the decisions on which three we have. But they're all covered under basically some sort of a Good Samaritan law of their own.
Right.
So there's no repercussions for administration.
Yeah. Okay.
we can't, we can't make them.
Do they have Narcan in the high schools, speaking of kind of epi and albuterol and emergency meds?
Yes, so it's epi, Narcan, and albuterol
Okay.
are the three.
Are the three?
Are the
Okay,
three, yep.
awesome.
Most of the schools accepted all three. There was a couple that did not accept the Narcan.
Okay.
That's what.
Right.
We're working to establish and have started a femur team, so fetal infant mortality review. So it's more of a clinical look at what happened during pregnancies that caused either a fetal death or an infant death. So that would classify anyone that never reached their first birthday. And more of a medical specific viewpoint. So we're looking over medical documents, nurses, doctors, even like the smoking history, stuff like that, but things that are much more, like a more documented, less opinionated, what if this, what if that. It's actually like the things that happened and occurred and then how those relate to the death itself. And we are part of a child fatality review team that's multi-county as well. So the femur's multi-county and the child fatality review is multi-county. It's more looking at the circumstances and less about the medical input. We have contracted with CAC to support their education for like their childhood education that teaches children the signs of either physical abuse or substance use or abuse in their own home. And then also to provide the mandatory reporting for either, care providers or educators.
And that's partnering with the Child Advocacy Center,
Mhm.
CDC. Okay.
And then we've also have a contract in place with Infants in Bloom. Yes, no? Okay, Infants in Bloom is a new agency that works with substance use disorder babies. Us and Switzerland County are the first counties, so they're currently in their beginning phases before they work on trying to expand. And the goal here is that they have pediatricians on staff. They're going in the home once a week with these babies or children. They follow them through a couple of years old and making sure that they're getting routine medical care. That also helps keep, it helps keep the parents accountable as well. So like it keeps them accountable in their sobriety if that's what they're choosing. It helps them with even, tobacco cessation if that's the route that they want to go through. It doesn't just have to be mother, baby. It can be baby gets put into a different home and they still follow that baby. And they bill insurance, they have, they can do immunizations, they have a VFC, that's Vaccines for Children program for certain government healthcare insurances, and then uninsured and underinsured children can qualify for VFC. We actually house their vaccine since we meet all the stipulations and requirements that are already over having. The VFC program is very strict on what you have to have, and we meet all those requirements because we currently have VFC. So we partner with them. And then tobacco and substance use category. I'm part of the Tobacco Coalition, the monthly meetings that they have, and then JCJ TAP. Those are both requirements of health departments. We have to sit on those on a monthly schedule. So I sit on both of those. We are in the initial steps of starting a SOFR team, so another fatality review. This is suicide and overdose fatality review. This is not going to be multi-county. Our goal here is just Jefferson County with just Jefferson County numbers. But like I said, it's just the beginning phases. We haven't really gotten very far with that yet. Then we have a We received a grant from the Bethany Legacy Foundation for a 3-year position for behavioral health services navigator. The goal with this is to get to know each and every resource in the county that deals with substance use or behavioral health, whether that's, an AA or NA meeting at a church or food pantries, and start having these connections and like a better connection with those people that are supplying that resource, so that when something changes or something's new or a new group pops up, that they're kind of directing people towards the health department to fill us in on any new activities that are happening in the county, so that ultimately we're going to be able to give those warm referrals to people when they come in the office, because we've made those connections throughout the county, and we're going to be able to connect those dots for people on a much more personal level. And the cohesiveness is something that we're definitely missing, because I feel like Jefferson County has a lot of resources, but oftentimes you kind of hear maybe something that contradicts that. I think it's just a lack of awareness and maybe more siloing than what we had hoped. When all these different agencies kind of popped up, they're all hoping that they can connect with people on just on a deeper level and be there and be their resources and understand what other agencies are offering. And I think there's just a disconnect with that. So we're hoping that that's a position that this position is going to be able to help with that gap. We have Narcan at the health department available to members of the public if they feel like they're in need or they want to carry it. That is a grant that we have, so it's free, no charge, 2-minute video, very painless. You sign off on it, and you walk out with Narcan. That same grant has us, we have a program that we're getting ready to roll out with local businesses, and if there's, whether that's a retail business or like an industrial employer, where we're going to offer Narcan for emergency use. It's not for distribution. We're not giving that to someone for them to distribute, but it's for those emergency purposes, with little window clings that say we have Narcan for those emergency use situations, where it would just, hopefully it becomes something that's recognizable and people know that that's someplace they can go in case of an emergency. Ideally that's not something that'll ever have to get used, but it's a really great way to be prepared for moments. We also contracted with the Freedom Center on behalf of the Jefferson House for trauma. It falls into the trauma and injury prevention category of the Health First funding. That's the lump sum funding that we received this year from the state to allow us to put a lot of these programs into place. For their group sessions, the statistics that go and support therapy and counseling in their group sessions for helping basically maintain a more positive lifestyle supports the health of basically the individuals, and it supports a growth and a trend, a positive trend in our community. So that was something that the state approved. And then we also have, under maternal and child health, we're working on a contract with Life Choices to extend our STI testing. We also have someone that comes in from Austin to help with that as well. Our capabilities are slightly limited, but by using our partners, we're able to reach different groups and also expand.
Who comes from Austin? Is it Thrive or?
I think it's Thrive. I feel like Thrive came once. I don't think who's coming now is from Thrive. I'm not really sure that. You can ask Blythe. Blythe will tell you. And then we also have our car seat program is still intact. I feel like that's something that, while it does get utilized off and on, it's something that doesn't really get a lot of attention. We do not have infant car seats, but it's not something that we're going to change. But we do have the next step up through boosters. I don't really have anything else for you guys, but I'm sure I've missed something.
It's okay.
I I don't know what that would be, but do you guys have any?
I have some questions.
Go for it. See if I can answer them.
So I'm wondering, the mental health navigator position, is there any plans to work with Jefferson County inmates upon release? Because that's members of our community, that's pretty high concentration of people with substance use and mental health disorders.
So I've talked, there's been conversations of working in partnership with the new JCAP program. So we don't really know what that's gonna look like yet, but it's been slightly discussed. I'm not gonna say it's been discussed in length because it has not. But it's not something that's out of the question, especially if we're able, I mean, we're not working with people and managing, you know, their needs as much as we're connecting them to the right resources, and potentially someone is somebody that can help them manage their actual like mental health and needs, but that's definitely not out of the question.
Well, I'm thinking maybe even staff there, or nursing staff there was made of it, like aware of it. It's a referral they could make as people are exiting the jail, that here's this resource in the community that can help connect you with
Good resources.
Yeah.
Yeah, absolutely.
And then, sorry, I don't know if we did. I had a question. These are just because you're here, not necessarily on things that you touched on.
Okay.
But I know in the last week or so, we've seen alerts coming out of Lawrence and Monroe County health departments of a huge uptick in lethal overdoses that are Narcan resistant. Are y'all seeing that in our county yet, or?
I have not been informed of that. It doesn't necessarily mean that it's not happening.
Right.
But at this point, that's not something that we've been informed of.
Okay.
So every death that happens in the county we end up with that. If it's here, if it's in Jefferson County, the death certificate, we house birth and death certificates.
Right.
Like, all that data is housed at local health departments. It's not a trend that we have currently seen yet, or if we have, their death certificates have not been finalized or processed. Yes.
Okay. And then speaking of birth and death certificates, we know there's some different executive orders that have come out federally and state level in recent months. But I did see a notice, Monroe County Health Department just kind of put up an educational post stating that they are still able at the county level to change gender markers on birth certificates that were issued prior to 2007 with a certified copy of a court order to that effect, and for changes with orders for birth certificates issued after 2007, they would have to go to the state health department for that. Have y'all been educated on this, or?
So, I do not do the birth and death records.
Okay.
We have a designated staff member who does that. I have been updated briefly on what we are and are not allowed to change.
Okay.
The general rule was anything, new. We cannot change the markers on.
Right.
So it goes to the state, and then the IDOH will send it up to the Attorney General.
Okay.
And then it follows that same trail back down.
Okay.
We do not know or have not been informed of what happens when it makes it up there and comes back down. It is not a process that we've gone through.
Okay.
It's not something that we've really experienced much anyway.
Sure.
From my understanding, it's only happened a couple times here in this county, so.
Good to hear. Okay. Other questions?
I have sort of an informational question. So when you're talking about Narcan, how it's available to the public for use, the 2-minute video, are there ever any other trainings available?
Honestly, Narcan is pretty straightforward.
Okay.
So a 2-minute video should do it, and it still has a pictorial description of how to use it on the actual doses.
Okay.
So it should, by looking at the pictures, jog your memory of the 2-minute video. It's, I
And
mean,
it's,
honestly, it's pretty.
it's safer to administer than an EpiPen.
Cool, I was just curious.
So, yeah, I mean, it's great.
Even
There's
without
also
the video.
a nonprofit, overdoselifeline.com, where you can go and order, they'll mail you doses of that and fentanyl test strips. And that's through.
That used to be who our grant was through. I'm not sure, it goes back and forth, so I'm not really sure who's doing the grant right now.
Right.
But I think it actually says it on the, like on the packaging, who supplied the dose and like with their website information as well. But it's honestly, it's pretty straightforward.
Okay, I just didn't know.
Yeah, that's a good question.
I've heard a lot in the news about measles outbreaks happening in different places around the country, and I was just wondering from your perspective, do you see our county as like an at-risk area, or do you have a plan in place if something does come up?
So, I don't know and no.
Okay.
We don't, they haven't come straight out and told each area. We can pull records to see who has, you know, documented immunization, like our documented immunization rates. Our immunization records and rates right now are at a pretty decent level, in accordance with the rest of the state, which, public health speaking, Indiana tends to be a little bit further behind than the rest of the country when it comes to public health, which is what initiated the additional funding for local health departments. But our immunization rates here in this county tend to be pretty decent. We are noticing a trend of parents. It's not necessarily their unwillingness or lack of cooperation. It's just that, or, you know, if we pick up the phone and tell them, hey, they're behind, they're willing to make the appointments, but getting the paperwork returned at the schools, and just getting them to come into the office is kind of low. And I don't know if that's a direct correlation with having to travel out of town. For some people have changed their pediatricians and not being able to get into pediatricians here. I don't know if it's a direct correlation or not, but our immunization rates are slowly kind of going in the wrong direction, arguably. But it's something that we're trying new techniques to see if we can't fix. And these are the required vaccines. We're not talking about additionals, or these are just the things like MMR. Yeah, those are kind of big. So we are watching it. We don't necessarily have a plan in place, but we stay up to date on the guidelines and what the state's pushing down.
With that, to piggyback off, I think, don't quote me on the years, but I think it's like people that were administered at like 1962 to 68 are at high risk of not having immunity. They weren't getting 2 doses then.
So I think it's 1957. Please don't quote me with the actual years.
It's something I didn't fall into.
It's
I know it was not my years.
1957 and before, I think, are considered to be immune, and then 1957 through 68, I think, are considered, they should have 2 documented doses, 1 documented dose, 1. And anyone after 68 should have 2. So
I've seen where some places are kind of offering some clinics encouraging people born between those years to come in and get that
so we're working on
dose.
some
So I didn't know.
documentation to put that out. We have ordered new doses, extra doses. I actually have it in my text messages, so I was gonna go see if I could find it really fast. Yes, it's 57 and 68, so those were the right years. You can't actually quote me.
Are there any areas in which you feel like you need additional help from commissions like ours or other groups in our community to really find greater success in what you're doing?
So I feel like when we get our behavioral health navigator on board, that might be something that this commission could help with, this committee could help with, just by making those basically warm warm welcomes. I like it when warm introductions to different groups that you guys know of, because it's hard to know all of the
I
individual.
mean, that's the issue, right?
That's the issue right now.
You don't
is
know what
that-
you don't know.
Yeah, and most people know a handful, so then they might intersect one person, and then you have all these other things that get left out.
One more question.
Yeah.
So the state funding that you guys received that's allowed you to really expand on some great programming, was that a lump sum? Is it paid out over certain years? And are we afraid with budget cuts that we could lose this and lose some of
Yes.
these programs? Okay.
So, last year we received, I think it was about 300 and, I don't really remember the number exactly.
Half of what you got this year.
Yeah, it was about 370,000 last year, and then this year I think it was about 720 because we had additional counties opt in,
Right.
so it got split a little bit less. It was a little bit less than
Yeah.
double.
Double.
But the talk is already out there that I think next year we're gonna probably be somewhere in the 3/4 ballpark, which definitely affects, how much, I mean, that's about $200,000 difference, so it definitely affects what we're gonna be able to do in the community. The initial ideology behind this was that this was in addition to the grants that we have. We're already seeing grants going away, which fund positions. And we already have a couple positions reliant on this new funding already. So to be good stewards of that money and then also meet our requirements for getting the funding, because to do this, the commissioners had to sign off on accepting this funding. And by signing off, they were saying, like, we have faith in the health department that they're going to be doing all of these core services. So we have to make sure that all of those core services are being worked towards and eventually achieved to be able to maintain getting this. But they did take away 2 of our state fundings. They got wrapped up into this new Health First funding, which already supported a fraction of 2 other employees' positions. So it's already in there as well. So yes, it is a concern that funding could be going away and putting a squeeze on our ability to not necessarily meet the requirements, but how far we can reach to do that. Man, that was a bummer of a question.
I know, but I'm calling the
And it's over. All right,
I'm
next.
calling the people of the state on my own time anyway, so I can always bring up some Health First funding while I'm leaving them a message.
So, the last 2 years, I went to Public Health Day at the State House. I did not attend this year, but the 2 previous I did. And the first year, it was, it was pretty crowded and it was kind of impressive. People were shocked. It was one of the largest groups. Last year, even larger. It was very impressive. This year, like a week beforehand on one of my IDOH meetings, web meetings, they said that they already had like 430 people signed up to go, which you don't have to sign up at all. They were just trying to gauge how many people were gonna be there. I heard it was standing room only, every level up. I mean, it was, they packed it. So it has a lot of support. I think it's doing a lot of good. We have, we're required to track certain aspects of each of the core public health services. So like in maternal health, they're wanting to know how many times have you referred someone to WIC, and how many times have you done this, and how many times have you done that. And it's just a long list, right? And they do that for every single one of the core services. So all of our partners and people we've given contracts to, I've sent them a spreadsheet for them to be able to track the exact core services that the state's looking for. So we're able to put those in, and every local health department's putting those in. So the state gets to see the impact of the money. And that's usually done by unique persons. So it's not the same person coming back in like 3 times that month, you know what I mean?
Right.
So it's, it starts adding up, it becomes pretty impactful, so, yeah.
Any areas you thought you would start working in that you haven't been able to, or just trying to find?
I was really excited about getting the fatality review team set up because I just think that they're very insightful. It can really show a trend in your community. I'm a little bit bummed that it's taken this long to get started, and it's not really of anyone's necessarily fault. It's just other things have been
Sure.
prioritized. The state, you know, they'll bring something out that they really want people to focus on, and it's good to have that direction. But I'm really looking forward to seeing our trends in this county, to see what kind of things can get put in place to kind of help.
Sure, it'd be interesting if you find some, wow, I would have never thought of that, you know,
Well, that's-
kind of thing. I mean,
yeah.
I think people have an idea, but
So that's how, I mean, we're talking a decade or more ago, like in Scott County where they had the needle exchange, it's because that data gets reported, right? Infectious disease data gets reported to the health departments, and because of that, they were able to see a trend and see where this originated, and they were able to help that and correct it. So until you can get the data all in one spot and see the trends, and we're not talking about just manners of death, we're talking about their history from the time they were a child until the time of death. So it's very detailed in this person's life, and it really highlights trends. So I think that that's something that's, I'm a little bummed we haven't been able to start yet, but while it's a very dark and upsetting topic, I think it's very, very beneficial to the community.
part of life. Yeah.
I would say, you know, with funding being in question and that sort of thing, if you're looking for grant funding from other sources and you need other organizations to sign on for grant funding with you, feel free to reach out to us, and we can always have discussions about collaborating on grant applications if needed. Because that's kind of what we're here for. I think we're here for community health and human relations, so I think that we are tied directly to what you do. So I think that that's just one way that we might be able to help in the future if you see that need arise.
Okay. Sometimes there are, now, this was before they started getting rid of some of the grants, but there have been in the past grants that us as the health department doesn't fit. But it's something that comes down either through IDOH, or, you know, IDOH is informed by another state program that definitely applies to this group, I would say. It's something I can keep in mind, and if I hear of them, I can roll them down, and maybe someone in the community can take that on. I think they do a lot of good. It's just not something that we have the manpower or the ability to be able to do, so.
Okay. Any final questions for Lindsay? Thank you so much.
You're welcome.
Thank you for being
If you have any
here.
follow-up questions, don't hesitate to reach out.
Yeah, it's great to hear everything that's happening.
Yeah.
It's really exciting.
Oh, Brian, some,
Okay.
we might find some grants, he's got grant money, so.
He's good at it.
Mhm.
Will do. Thanks for having me.
Thank you.
Yeah.
Thanks for coming. All right. Well, just as a note, I know we've invited several other groups to come. I have heard from Ruth Haven, and they are planning on coming, they just don't know which meeting yet. And make an action step for me to follow up with the other organizations I haven't heard from to do a second round of follow-up. Thank you, appreciate that. So next on our agenda, follow up on action items from previous meetings. I'm going to, really quick, since my computer battery is low, start with me. Looking into other communities that have strategic plans that kind of fit what we are. We were talking to Brian about that, and I did a little research, and I have nothing finalized at all. But I just wanted to give y'all a little bit of info about what I've found as far as what a strategic plan would look like for a group like us. So we can start thinking about that and some of the blanks to fill in. I started brainstorming a little bit, so feel free to jump in. I'll try to like round out a document and share it out, so if people want to contribute, that's one way we can do it. But yeah, so the first thing you need is a period of time for a strategic plan, because they are planned and they have a time span. So that's something we need to think about. They often address the future, so like a vision of what is to come with your group, and so that's something to be thinking of. There's also like a mission and values associated with that, and we kind of have a lot of that already in our mission statement. We can work on kind of hammering that down more if we want for our strategic plan. Our goals is the next thing we would look at for our strategic plan, because a plan has goals. And that's usually the bulk of it. I don't know, threw some things down while I was thinking and looking at other groups who have done them. But I think one thing that we have really been striving to do that we could do more of is try to work collaboratively with other community organizations. Lindsay was just talking about the siloing that happens and how like arresting that is to momentum in our community. So I think that's something that we can try to do. We can also seek volunteer opportunities to promote and participate in with those organizations. I think education is part of our mission, so that's something that we can be even more deliberate about. Specifically education on community issues and resources. Hearing Lindsay talk about like vaccines, we need to remind people about vaccines, like that's imperative. So things like that, we can talk about like how we want to approach what messages we want to get out in the community and how we do that. And there's all sorts of things like just general problem solving. We're going to focus on our most vulnerable populations, expanding awareness about us and our platform. That's something I think we've been trying to do, and we could probably do more of and more deliberately as well. Part of kind of what we do is help advise the county commissioners on how to make a welcoming and healthy community. And so we can like put some bullet points under that with our goals. And then I think we could probably, Sarah Morgan at the courthouse does a great job with helping us out with our website and doing things like that. But using technology and other media to meet our goals, I think is going to be a big part of what we need to do, whether it's having a social media page or something like that, where we can consistently share out information that's more interactive than our website. So that's what I thought. I'm going to keep thinking and I'll share out so we can all think about it together.
I love the social media aspect. That's my generation. And
Yeah.
like, I don't get on websites if I don't have to, so.
Yeah, I know. I'm like, link me to a website. But yeah, it is important to have a website just to keep things, but it is not always our first instinct to look through that. So other things, before my computer dies.
So I'm gonna add a couple things
Okay.
to that, just because going through the comprehensive plan development, some of the things that were pretty, I think we probably want to break it into some categories. The comprehensive plan had different, and kind of focusing on those sorts of things. I mean, this one came out of one of those focuses, so doing something like that. I mean, we probably can take advantage of some gatherings already to get some input from folks. We're at some already. I know the county, we're gonna have to, if you wanna go into there's gonna be a couple probably well-attended, one for sure, one maybe not as much, but attended by the public. Hey, we're looking to put together a strategic plan. What would be some of your input? So a place where you might not get, people who you might get and be in contact with that you wouldn't expect to be in contact with for these other things. So we can kind of put some things down to just take advantage of those things that are going on and get some input.
So maybe prepare like a short survey that we.
It could be, yeah. I mean, we can look at what we did for the comprehensive plan and look at some of those things and kind of make it so it's for this, but I think that would be a good place to kind of start. I think somewhere in the goals, it was, you think, okay, we got goals, but some are like next year, but some are, it can be 5-10 years down the road. So kind of splitting them out because you want to see some successes. You don't want to put something 10 years out and say, well, I mean, none of us will ever see it. People will be going on to something else and people are like, what is this? We're not going to do that. I mean, so.
Absolutely. Okay.
But I think there's some things there that we can, I'll look at kind of what, with the consultant we had to put together the comprehensive plan, what are some of the things that she kind of put together and we can kind of modify them to fit what we want to do.
Okay.
So I'll get a hold of that. I'm trying to make up for that because I haven't done the next two, so you can, I haven't heard back from Alan Abbott. I'm trying to give him a little bit of time because I heard towards the end, just before the last meeting, and so, but it will be 2 months and I'll get out to him. I haven't seen the memorandum of understanding with LifeSpring, so I was kind of waiting on that, so I may reach out anyway, but I was hoping to get, so that way they'd be putting the thoughts together. What are we going to do for this settlement? Where are we going to think it'd go and things like that. So I'll get that one too, so you can keep that one on me.
Okay.
Just copy and paste them.
Great. I'm looking at my notes. Because that pretty much covers everything I had for action items for following up. DJ, did you see any that we missed?
The only addition, from last month, let's see. So you sent the notes for inclusion of the minutes. We talked about the LifeSpring. You continued strategic plan research. There's also a conversation about inclusive wedding venues or other wedding adjacent businesses.
Still working on that.
Okay.
I'm thinking of a bunch of the events, kind of like we were talking about this summer. I'll be able to network more. That would be like part of the focus of if we are there and present as a group, we can be looking for stuff like that.
Absolutely.
Sign up sheets or something.
And then I think Dave Bramer, I had look into term appointments for the current members so that could inform our conversation moving forward.
Okay, great.
And then the last thing was that all of us should consider the best fit for the committee with the new member applicants and then review those. And decide if we need to request additional information from those folks.
Great. So that means the only thing we need to do is new business, which includes reviewing the applicants and doing our decision making on that. A little bit before our meeting, I sent out an email with a resume. I don't know if everybody had time to look at it. Do y'all want to take like 5 minutes and review it, or before we continue that discussion? Okay, we got the review. All right. So yeah, we have two choices, Stephanie Godward and Lauren Steele. We discussed this a little bit last time, but we really just wanted to hear more from everybody. And we have everyone who wasn't here last time is here today, which is so great. That's kind of why we paused on our decision making, so we can kind of have everybody's input. And it's kind of a tough situation, but also a really great situation because we have two great applicants that are really qualified. But we have currently one spot. And I will note that we will have other members roll off and the next
And
person
isn't that
will
in
roll.
May? I mean, I don't feel like it's far off.
I think it's at the year is
Yeah.
what.
The end of the
Or
year.
whenever somebody decides to roll off. If somebody like, I think we did start in May, started having meetings.
Yeah.
But I think that the way that the commissioners usually do it, they do it at a new year.
Okay.
So it would be like December. Okay. But if we need to roll off early, if that was kind of like, if you're burnout, then that's something that people have done in the past. It doesn't mean that you won't be able to come back on. It's just a matter of timing that makes sense for the commissioners to do it at the beginning of each year.
Okay.
So the person who isn't selected would either roll on at the beginning of next year when some of our members roll off, or when a member rolls off, if they roll off early. So, I mean, technically, I was supposed to be here for 1 year.
But we love it.
So I'm working like 2 now, so that's fine. I'm keeping in mind what works best for me as well, and for the commission, because the whole point is to have a wealth of minds and cycling, and that's what's good for a commission to stay relevant and relevant to our community as a whole, is to have that movement and cycle. So yeah. Is there any discussion about our applicants, about who we think we want to continue with first? Because we can do a vote. I think the hard part is, I'm not sure if we should just vote between the two, or if we should agree as a group who we want to vote to send forward to the commissioners. It's hard.
Can we just put their names in the hat and draw?
We could do it randomly. I did bring up one point last time. I think Lindsay Fallstick said last time that, and maybe DJ as well, that they personally know Lauren. She works in their office and gave good recommendation. I know Lauren. We are acquainted. I don't work with her every day, so I don't have like strong opinions between either of them, and that's kind of what a lot of us agreed on. I will say the one concern I do have is in trying to make a committee that serves our whole county. We have about 1, 2, 3, 4 of us who are employed in some way by Hanover College. And it would be 5 if Lauren came on, which is more than a majority. Which I don't know how I feel about that. Well, I guess I do. That's the one kind of hesitation I have in that case. And it isn't anything about her qualifications, but just as to keep a committee that is diverse for the community being served. That's my one concern, so.
And definitely if she came on later in the year, we might have cycled out some people who were from Hanover College. So we still get the representation.
Absolutely, so.
I know Stephanie, the other applicant, and, while they're new to this community, she really has gotten involved with several different things in the community. So, I think some of her, definitely her work experience, I think could serve us well on this. She's done a lot, working in nonprofit in the past. She's now at University of Louisville working there, so still somebody in the education realm, which we seem to have a lot of on here. But anyway, she's just got a lot of passion and gump and drive and some talents that could be helpful. So,
Yeah, and I think it's no coincidence that so many of us are in education, because education is a big part of, yeah, this.
Right.
So,
I think just on the short list of things that you had brainstormed, strategic plan wise, I think that a lot of those things fall in an area in which Stephanie would have an expertise. I think Lauren, and I think she's great, but I agree about the concern about the diversity perspective that we'd be able to get from having a lot of people with the same employer.
oh my goodness, are we starting to move towards?
You kind of made it really easy. That was a really sound, logical, yeah, that makes perfect sense to me.
Yeah, and I mean, she looks like a great candidate, but I think that is nepotism. It's not everybody in the same family, but you're all in the same office and working closely, and
Kind of
we don't want
just a strategic approach to how we're gonna fill the board, to include all corners of our county and make sure that voices are out there from all different areas and, so yeah.
And that doesn't mean that we couldn't like invite her to volunteer and help us when we do have booths, so that way she can get to know, you know,
Keep her in the loop.
yeah, so she can stay completely in the loop and know that we do want her, and you know, that as soon as that position is there, it'd be an easier slide in.
Okay, and this is the other odd question. How many of us live in Hanover?
Oh my.
Yeah.
I mean,
Lauren doesn't,
Lauren doesn't, okay.
Okay.
but her job is
Actually, I live
held
with
at Hanover.
And the three of us live within a mile of each other.
Yes.
Yeah. Well, 4.
Oh, yeah, I was gonna say the four of us live within less than a mile of each other.
And he's right around the corner.
I'm not sure why I get left out.
Man, sorry. I guess I don't know exactly where you live.
Oh,
That's
Phil's.
why.
Okay, no, he's there too.
Yeah.
Yeah,
All right.
so next thing is to make sure the person lives in Madison.
Yeah, and just to clarify, Dave, if like somebody in July needs to roll off, would we then at the next meeting be able to put them forward? Okay.
Yeah.
All
Yeah,
right.
there's nothing, no,
You're forced to stay on.
You know, obviously Dr. Murphy decided to leave in the middle.
Yeah, we've had several people who have had to leave for
Sure.
different personal reasons, and that's perfectly fine. It's a commission. And so, yeah, people need to do what's best for themselves, and that's okay. Yeah, it's not an elected position, it's an appointed position, so, yeah.
We certainly encourage them to come back and at least visit, put in their input and to give us their opinions when we have our meetings.
Yeah.
I think it's important that we always invite them and let them know that, you know, we are still meeting on this day and we would love for you to come join us.
I can see if I can get all the email addresses back together. Let me pull up my notes here. So, without doing an official vote, we'll do an official vote for the nomination for the commissioners, but are we in agreement that Stephanie Godward is who we're going to
Yes.
vote to move forward?
Yes.
Okay. All right, then I'm going to make a motion to propose to the county commissioners that Stephanie Godward be the individual that fills our final seat of 9 in the Health and Human Relations Commission. Who is, you second? Okay, great. All in agreement?
Yes.
Any opposed? Okay, great. Then that is approved, and we will ask Dave for his additional action step to take that to the
Get it on the
commissioners.
agenda for the next meeting is the 3rd, so.
Great, got had to do something uncomfortable. We did it. It's so hard.
Well, I think, we had one spot and you had 2 applicants. I mean,
Yeah.
That's a good problem to have, 2
Sure.
very qualified applicants, we have been struggling with quorums and
I know.
and
We need to
look
fill it
at
up.
this.
It's great. Yeah. So yes, there we go. We made a decision. I have another point for new business. Be thinking if you have any. One, I went to the Bethany Legacy event earlier in March, where they were talking about kind of their new goals. For some reason, I can't find my notes on it right now.
on the 20th,
Was anybody else there?
I was in the commissioner meeting.
Okay. Bob was there. Bob has all the notes. I read about it in the newspaper. Yeah, well, that's good to know. What I do remember from it is that they were kind of outlining like a lot of the research they've done over the years and meeting with the community about what needs need to be addressed. They had some guest speakers talking about different initiatives that are coming up in the county for health, for housing, for there was one about managing finances, like helping with financial planning for people in our community, and a possible mental health facility that is combined with essentially a healthcare facility. So it's like all health needs, mental, physical, could come to this space.
That's this LifeSpring
Yes.
facility.
That's the one that we're following up on there. So they had a brief presentation about what that might look like. So really good things are happening. I think they have a good directive. They've been working on this for a while, and
They went through Health First too.
Oh, so the Health First funding?
Yeah.
The first
Yep.
from the state was there.
yeah, they recognized Lindsay in that presentation and talked about like it was interesting. They like monetized all the health issues that affect us in the state, like smoking costs the state this much money. And so we're trying to work on programs to, lower rates of smoking that cause all these health issues that cost us this much money, et cetera, et cetera, et cetera, through all of these different issues. So, which was an interesting approach, but I guess some people just need the literal like dollars and cents of what that works out to be to really see the need of it. So so it was a really interesting presentation. Yeah, I'll have to pull up the article and put it with the minutes when we send it out or something. So yes. But yeah, we should see some interesting stuff coming up with Bethany Legacy. They're also opening their grant portal. I think it's open just this week. So I don't know if do we qualify to apply for grants as a commission? Is that something we can do?
I would say we could. I don't think there's any requirement that you have to be a 501c3 or anything like that. So
Yeah.
if we had something that we wanted to do, or I don't
Unless
know.
there is times that we're like, we don't have
We don't have any money.
Sure.
any money, we want to help.
So if we have a good idea, especially as we start thinking about strategic planning.
Right. And maybe, maybe that is one.
Yeah,
You want to bring in someone to help us do that.
yeah.
I don't know how long the portal's open, but that might be something to.
Well, we had discussed taking, when we do samples and bad things at our booth to bring people to it, so we would then use money for that as well, whether it be little, little toys or something for you to bring kids over or to bring the adults over. I know we had discussed that as well, but we didn't have the funding to be able to do so. So one could be set up around Juneteenth or for Pride Day, have the literature so we could print it out.
Yeah. Yeah, that's something to think about. And it doesn't necessarily have to be for this year. If we want to apply for like $100 to do stuff, that's one thing. But if we want to apply for a grant that's like, we have a big 10-year project that we want to see through, that's a whole nother thing, so.
Yeah.
Yeah, something to think about, and possibly including the strategic plan. So yeah, I just want to make sure you're all aware, that there's a lot going on with that and to pay attention to what they're doing with all of their research and community needs, so. So yeah, any other new business?
I didn't go to the meeting, but they had a meeting on, it wasn't a Y, but it is a Y, so that facility, sounds like it's still moving forward, although I think there have been some changes in who's leading the effort.
Okay.
But that was Tuesday, they had that meeting. And so it sounds like there's more involvement from the Y organization and has some interaction with the one in Switzerland County and things like that. So it sounds like, I don't know if they've identified some places to put it. And they still some interaction with the hospital, so probably pretty close to the hospital, but I don't know if they've said this is the spot, but they know about where they want it. So still moving forward.
Yeah.
Good. So, yeah.
Have they like finished their feasibility study or is that still in process?
The person that went to the meeting didn't mention that, so I'm not sure. I was catching it secondhand from someone, but sounds like we've worked through some of the issues and it looked like they're getting ready to go forward.
Okay.
So that would sound to me like they have
Yeah.
finished the feasibility study, but I haven't
Something
seen.
is feasible.
Yes, yep.
Is there a formal way to refer to it? There was a recent meeting about not the YMCA.
The community,
Healthco or something, what was their name or something?
Healthco Community Center.
Something like that.
Interesting.
Yeah, that is different from what they were called before.
I'll put it on the
A mouthful.
to see.
Yeah.
I don't like it.
Sounds corporate.
Yes.
No judgment. Well, I hope it works out, because, yeah.
Well, I think just like the LifeSpring thing, which would be to help people, not only the mental health side, but just general healthcare. And this would help, people need to get out and do stuff, do more stuff.
Yeah.
You know,
Be able to
so
have something to do.
when I get home, I need not quite 5,000 steps, so I'm gonna go out walking when I get home. So even if just people get out and do that.
Yes.
Do you want to take my dog?
Sure. Will he or she go with my dog?
He's friendly. He's a
very
dog walker.
Oh, thanks.
All right, any other new business? I know there's some events coming up. Juneteenth, do you have those flyers?
I sure do. I've got 2 posters.
Oh, yay.
So the posters are completed, and it's June the 21st through the 23rd. It'll be of course, there'll be the walk run on the 21st, and then on June the 22nd, that'll be on the Lanier Mansion lawn, and that one will have the music, vendors, different food trucks, we'll have a plethora of different food trucks as well. Dancing, we'll be teaching line dancing and teaching different dancing on the lawn. It's totally free and open to everyone. The 5K, 5K walk and run, that is going to start at Gaines Park, historic Gaines Park, the foot of Broadway. So that would be on South Broadway. You go which direction I'm going. No, North Broadway, that'd be on the north part of Broadway. And we'll also have the DJ there as well. They'll do awards for tenure, so they have for children also. So really encourage young people to come. If you have nieces, nephews, little cousins, your kids' friends, just to bring them. The kids have a great time. They don't do the full 5K. They just do about a block and a fourth with them evening. But they have the best time. I mean, they really do. They all get a little reward afterwards. Everybody receives a historic Underground Railroad medal. So you do go through the old historic parts, old Black historic parts of Madison. Most of them are tagged, so we have a lot of people that do the run and then go back and read the different history of the spots. And then on Monday, the 23rd, that was gonna be about a book, and it's about Tenacious Nurse Nichols. So you're more than welcome if you want to go ahead and start reading it. I've already started parts of it, and it's really interesting. But they'll have a book discussion for that, so I do have the posters for that. I'm trying to smooth out, because I rolled them and thought that would be like really neat to do. Obviously, it didn't turn out the way I wanted it to.
And Pride is the Saturday before at Linear, on 14th. And I just want to put in a plug for that Juneteenth 5K. I have not done it, but I'm a marathon mama, so my daughter participates in 5Ks and 10Ks and half marathons and marathons, and it is very unusual for every participant to get a medal at the 5K level. She's done the Juneteenth run the last 2 years, and we've got friends that came over from New Washington last year and did it, and it's a great time. So even if you can stand with this marathon mama and cheer for them, if you don't walk or run it.
And we are very fortunate. The town comes, people come down, they cheer them on. If you want to volunteer, please just let me know.
Okay, that's what I was gonna ask.
Say if you want to volunteer, you're welcome to contact me. You're welcome to contact Sue Livers, either one. We can always use volunteers for setting up, for the run, after the run, setting up. If you have vendors that you
Are we
know
set
about.
up as a vendor again this year? Me and, who was me last year? Maybe it was just me.
I wasn't here for Juneteenth last year.
Yeah, I think it was just me and Jill were maybe near each other because she had stuff from March.
But yes, I will definitely put you down as a vendor. They'll definitely put us down as a vendor.
Okay.
Yeah.
So yeah,
that's
it's all in your calendars. Yeah, I haven't got my summer calendar figured out yet, but I will make it, and
It's
I
the
will
process
do my
of
best
my
to be there.
calendars, getting my calendar together.
yeah. I volunteered at the run too, and it's pretty fun, handing out the little bit numbers and all that stuff. So if you do want to volunteer, putting out signs or anything like that, it's
Like I said, just worthwhile and see the plans. So just so you guys know if you get a hold of me. If you can't get on me, let's get a hold soon.
her email's on our email chain.
Yeah, my email's on there, and so is my phone number, and then this one's under LenaSue@yahoo.com for more information. There's only 3 sets of livers. It'd be me, my mom, or my dad. So you can get a hold of them.
Any of the letters.
We're pretty easy to get a hold of.
Thanks. I'm excited about these events. It means summer's coming. It's like,
And like I said, I brought extra posters, so if you have places you know you can hang them, please take some. And then if you need more, let me know, and I'll be more than happy. Most of us live in Hanover, so I'll be more than happy to definitely drop them off. And those of us that live in Hanover, downtown, on the hilltop on the regular, so I'll be more than happy, like I said, to put them in your mailboxes, drop them off. There we go.
any other business coming up to discuss?
Oh, last, if you have any vendors, please let them get a hold of me as soon as possible so I can start on them. I'd like as well, so I'd like to set this, give them my number.
Yeah. Cammie, who do we reach out to if we want to have a table at the Price?
So Wayne Kyle is over vendors, so I can send that email to you if you want, or
Great. I feel like I've talked to him before. I don't know if I've emailed him.
yeah. I may have a flyer I could even just send to you to include in minutes, and then has that information or screen or something.
We can make that an action step for me to make sure we're set up to have a table at Juneteenth and at Pride. Warm weather. I'm so excited.
Which I was thinking, if we have a table, another reason why we might seek grants is to get like a banner
Oh, yeah.
that has like the HHRC on it,
Well, and
that we can just transfer to different events.
we have 2 different but what they do is they have different stickers, and then they have their information. So if you want to be part of their group or want to help out with it, 2 of the different vendors that I know that will be there, that's what they do. So they have like the, put the water on them and you do this and it gets on the kid. And
Oh, like the temporary tattoos.
Yes, yes, and so the things that, like, that brings the kids there, the hula hoops, so the kids can hula hoop, and you do it for so many seconds. I know that there's, we probably would have access to, like, the spin like Jeopardy wheel, what is it, that goes in a circle, and if you land on green, you get a little bracelet, if you land on, so.
Yeah, it was nice at the health fair, I had a
We had the
Plinko
Yes.
thing
Mhm.
that we were able to borrow from College Student Life
And
Office.
since there was such low attendance, we didn't make them stick with what they
Yeah.
landed on, but it was still fun to
That's
interact.
kind of what we have access, that's kind of where.
I'm like, oh, I just thought of that, maybe
Access
oranges.
to get
Well,
those
grab some
things.
bananas, take something.
Yeah.
Here's your favorite.
But it helps to engage people,
Yeah.
Yeah.
if you have something.
Like to have that approachability of
Yeah.
something to do, and not just pieces of paper, that's a big thing.
Yeah, so, I mean, there's different components, but offer to bring certain things back, it's not a problem. Yeah, even if they have cornhole, I know that was a big thing, for Pride, they had cornholes, and the cornhole, they had a little cornhole thing going on, and trying to remember which group had it, because I remember setting it up, because I didn't realize it was like a distance you're really supposed to be. And there's like real people that
I
are very
wouldn't know that
serious about it,
It's
and I
an
thought,
official measurement.
yeah, I thought this is just for fun and I'm just helping some people, so I really don't know that there's an actual distance thing here. But they did that, and so if you got like so many of them in there, then you got like a keychain. And it was for this one particular organization. And then if you got another X amount of winner, you got like, one of those little plastic cups or.
Yeah.
So, yeah, I think it'd be great if we could start looking at getting some grant money.
Yeah.
So we could do that.
There's probably some stuff I could donate. My artworks,
Yes.
because I just printed 100 new postcards. For another event, an art show thing, so if I have leftovers, we can always have those. So, well, good. Yeah, we can keep brainstorming about that stuff and try to have plans for how to make really interactive and fun ways to engage with the community so that we can more effectively spread our mission. So,
And so people will know to come to us, like, oh, we can go to them to help a little bit more.
Yeah. Yeah, another thing to think about is like other ways we can volunteer. I know in our last meeting, I was reviewing the OVO info. And we were talking about maybe going to help out with winterization or read books to kids in their preschool and things like that is something we could do if we want. We don't necessarily have to do it as a group, but as like individuals. I don't know if we want to work into, I'm coming back to our strategic plan, sorry, off the topic, like goals for our memberships to do volunteer work in the community, just to make sure that we are engaging in that way. I don't know. I might already do it anyway. So, all right, so next, review action items for our next meeting.
All right, I have Jane Stormer will follow up the organizations we have not heard back from yet about attending our meeting. They continue follow-up about the Chelsea Flatwood Nature Reserve regarding Alan Abbott's update from the Nature Conservancy. And also have that you will follow up about the county, working with the mental health facility assessment in Lake Spring. And also that you're going to look into term appointments for the current HHRC members to inform the conversation about new membership. And then Jane will register tables for the HHRC at Juneteenth and Pride. And then I also included the email of the Pride vendor coordinator on that all action points. You can have that.
Can you add one more? Have me follow up with our applicants about our decisions this meeting, so I don't forget to. I don't think I will, but yeah, I always like to have a prompt to do so. All right. So with that, did anybody have any others to add? Okay. Our next to last agenda item is future meeting dates. I have April 24th, May 29th, and June 26th. Is anybody seeing like noticeable conflicts? I know that the June one, I'm not gonna be in town, I'm volunteering out of town.
I might be in Texas for the April one.
June, I have
What
no
was
idea.
the May and June?
Million babies.
May 29th, June 26th.
I wonder when the phone doesn't work out. So you said April 24th, right?
April 24th, May 29th, June 26th. I feel like I'm calling bingo.
Okay. The April one will be the only one that I can see I would not be able to make it to.
Okay. So there's a couple possibly in April. I know that's the college spring break. I'm boring, so I'm not gonna be anywhere. But, are we, I guess I could check with Lindsay and to see if her availability, if we're missing 3, we'll still have a quorum. So if anybody else thinks they're not gonna be able to make the April meeting, let me know, and we can possibly adjust if needed. But I think we'll leave it on the calendar since we will have a quorum as of now. Especially if we have a new member possibly. So, all right. Just let me know if y'all have any concerns about dates or anything like that. And then next final agenda item is adjournment. So I'm going to make a movement to adjourn tonight's meeting.
Second that.
Okay. We'll go with Cammie this time. So Cammie seconds, and we are adjourned.